Schizophrenia is a chronic and severe mental disorder that affects how a person thinks, feels, and behaves. People with schizophrenia may seem like they have lost touch with reality, which can be distressing both for them and for those around them. The condition is characterized by a range of symptoms. The exact cause of schizophrenia is not fully understood, but it is believed to result from a complex interaction of genetic, biochemical, and environmental factors. Schizophrenia typically emerges in late adolescence to early adulthood, often between the ages of 16 and 30. It is rare for schizophrenia to be diagnosed in childhood or after age 45. Schizophrenia can significantly impair a person's quality of life if left untreated. However, with appropriate treatment and support, many individuals with schizophrenia can lead fulfilling, independent lives.
Schizophrenia, the word itself often evokes fear and misunderstanding. It conjures images of a split personality, violence, and unpredictability. But these are harmful stereotypes, far from the reality of this complex mental illness. Schizophrenia is not about multiple personalities. It's a disorder that disrupts the way a person thinks, feels, and experiences the world. Imagine a world where thoughts race uncontrollably, where voices whisper unsettling messages, and where reality itself seems to shift and distort. This is the daily struggle for millions living with schizophrenia. Their experiences are often invisible to the outside world, shrouded in stigma and misconception. This lack of understanding leads to isolation, fear, and delayed treatment. It perpetuates a cycle of suffering for individuals and their families. We must break down these barriers, replacing fear with knowledge and judgment with compassion. It is time to shed light on the true nature of schizophrenia, to understand its complexities, and to offer support to those who navigate its challenges every day. Schizophrenia is a chronic, severe mental disorder affecting about 1% of the population. It impacts a person's ability to think clearly, manage emotions, make decisions, and relate to others. It's crucial to understand that schizophrenia is not a split personality disorder, as often portrayed in media. It's a disruption in the brain's normal functioning, affecting various aspects of a person's life. This disruption manifests in a range of symptoms, broadly categorized as positive, negative, and cognitive. Positive symptoms, such as hallucinations and delusions, are additions to a person's normal experiences. Negative symptoms like apathy and social withdrawal represent a decrease in emotional responsiveness and engagement. Cognitive symptoms affect memory, attention, and decision-making, making it difficult to function in daily life. Schizophrenia is a spectrum disorder, meaning its presentation varies widely from person to person. Some individuals experience brief episodes with periods of remission, while others face persistent and disabling symptoms. Early diagnosis and treatment are critical for managing symptoms, improving quality of life, and preventing long-term complications. The symptoms of schizophrenia can be incredibly varied and often manifest differently in each individual. Positive symptoms are often the most noticeable and include hallucinations and delusions. Hallucinations are sensory experiences that occur without external stimuli. A person might hear voices, see things that aren't there, or feel sensations on their skin when nothing is touching them. Delusions are firmly held beliefs that are not based in reality. Someone with schizophrenia might believe they have special powers, are being followed, or that their thoughts are being controlled. These experiences can be incredibly distressing and isolating, making it difficult to differentiate between what is real and what is not. Negative symptoms are less dramatic but equally debilitating. These include a lack of motivation, social withdrawal, difficulty experiencing pleasure, and a flat affect where a person's emotional expression appears diminished. Cognitive symptoms often go unnoticed but significantly impair daily functioning. Difficulties with memory, attention, and executive functioning make it challenging to follow conversations, organize thoughts, and complete tasks. This can impact a person's ability to work, study, or maintain relationships. While the exact causes of schizophrenia remain elusive, research suggests a complex interplay of genetic and environmental factors. Genetics plays a significant role, and having a close relative with schizophrenia increases the risk. However, having a genetic predisposition does not guarantee developing the disorder. Environmental factors during pregnancy and early childhood, such as viral infections, malnutrition, or birth complications, may also contribute. Substance abuse, particularly marijuana use during adolescence, has been linked to an increased risk of developing schizophrenia in those who are genetically vulnerable. Stressful life events such as trauma, abuse, or significant losses can act as triggers, particularly in individuals with a predisposition to the disorder. It's important to remember that schizophrenia is not caused by poor parenting, personal weakness, or character flaws. Research continues to explore the complex interplay between genes, environment, and brain chemistry to understand the underlying mechanisms of this complex disorder. This understanding is crucial for developing more effective treatments and prevention strategies. Schizophrenia's ripple effect extends far beyond the individual, affecting families, relationships, and society as a whole. The unpredictable nature of the illness can strain relationships, leading to fear, frustration, and a sense of helplessness. Stigma and discrimination are significant barriers to seeking help and living a fulfilling life. Many individuals with schizophrenia face social isolation, unemployment, and difficulty accessing education and housing. This marginalization can exacerbate symptoms and create a vicious cycle of exclusion. The financial burden of treatment, including medication, therapy, and hospitalization, can be substantial, adding to the stress and hardship faced by individuals and families. The lack of understanding and support from healthcare systems, employers, and communities further compounds these challenges. It's crucial to remember that people with schizophrenia deserve compassion, understanding, and equal opportunities. By promoting awareness, reducing stigma, and providing adequate support, we can empower individuals to manage their condition, build meaningful lives, and contribute to society. Navigating the path to healing involves understanding that while there is no cure for schizophrenia, effective treatments can manage symptoms, improve quality of life, and support recovery. Antipsychotic medications are the cornerstone of treatment, helping to reduce hallucinations, delusions, and disorganized thinking. Therapy plays a vital role in helping individuals develop coping mechanisms, manage stress, improve social skills, and enhance overall well-being. Cognitive behavioral therapy can help challenge negative thought patterns, while family therapy provides education and support for loved ones. Social support is crucial for recovery. Support groups provide a safe space for individuals to share experiences, connect with others, and combat isolation. Vocational rehabilitation programs can help individuals develop job skills and re-enter the workforce, fostering independence and self-esteem. Early intervention following the first signs of psychosis is critical for improving long-term outcomes. By recognizing the early warning signs and seeking prompt treatment, individuals can experience milder symptoms, reduced hospitalizations, and a better chance of achieving their full potential. Understanding the psychological experience of schizophrenia requires stepping into a world where perception, consciousness, and identity are profoundly altered. Imagine a reality where thoughts are no longer your own, where voices invade your consciousness, and where the boundaries between self and other become blurred. This fragmentation of the self can be terrifying and disorienting. Imagine questioning your own senses, doubting your memories, and struggling to distinguish between internal and external experiences. This constant state of uncertainty can lead to anxiety, fear, and a profound sense of isolation. Despite these challenges, many individuals with schizophrenia display remarkable resilience, creativity, and insight. Their experiences offer a unique perspective on the human mind and the fragility of reality itself. By listening to their stories, we can gain a deeper understanding of the complexities of consciousness and the profound impact of this illness. Schizophrenia is a complex and challenging illness, but it is not a life sentence. With the right treatment, support, and a compassionate society, individuals with schizophrenia can lead fulfilling and meaningful lives. We must challenge the stigma and discrimination that prevent individuals from seeking help and living with dignity. By promoting education, raising awareness, and advocating for increased research funding, we can create a more supportive and understanding environment. Let's remember that behind the diagnosis are individuals with unique strengths, talents, and aspirations. By fostering compassion, empathy, and acceptance, we can build a bridge of understanding, connecting those living with schizophrenia to the support and resources they need to thrive. Hope for recovery begins with a collective commitment to break down the walls of stigma, replace fear with knowledge, and offer a hand of compassion to those navigating the uncharted waters of schizophrenia.
And if you found this video interesting, don't forget to like, subscribe, and hit the notification bell for more mind-blowing psychology videos.